Hello, everyone. My name is Craig Struble, and I'm a consultant at CERC. Welcome to the series entitled Supporting Your Child's Health and Well-Being During the School Year, brought to you by the Connecticut State Department of Education. Tonight is part 3, Protecting Our Youth, a Community Approach to Suicide Prevention. Before we get started, I'd like to go over some of our Zoom features. The first feature is sign language interpretation. You may have already seen this notice pop up letting you know that sign language interpretation is available. If you would like this option, select the interpretation button on the toolbar. If you do not see this button, you may need to select the More button on your toolbar. After selecting the interpretation button, a menu will pop up. Then simply select American Sign Language. You will then get a pop-up window with our sign language interpreter. The next feature is closed caption and caption translation. If you would like the captions on, select the Show Captions button on your toolbar. If you would like to change the language of the caption, select the small arrow on the upper right corner of the button. When the menu appears, toggle Translation on. Then choose the caption language that you would like. Next, we have our chat button. Please use this for sharing information, providing reactions, or also for mentioning any technical difficulties that you may have, and we'll do our best to help you out with those. However, please do not use the chat for any questions that you may have for our presenter, because those can sometimes get lost in the chat. Instead, for that, we have the Q&A button. When you select this button, a window will pop up. You can use it to ask our presenter specific content-related questions. And if you see that you have the same question as someone else, you can give it a thumbs up and upvote it. Finally, we have the React button. Select this button to use emojis to show your reactions throughout the presentation. And that's it for our Zoom features. So now to get us started, I'd like to hand it off to John Frassinelli, Division Director of School Health, Child Nutrition, and Family Services.
Thank you, Craig, and thank you for our partners at CERC for participating tonight. I want to also acknowledge our partners at the Department of Children and Families and the Department of Mental Health and Addiction Services for this important conversation tonight about teen suicide. Please know that there are a number of supports available for you and your families, and our team will go through all of those tonight. We just want to make sure that, given what's happened over the last year with teen suicide, we want to make sure that everybody understands avenues to get support when they need it. Reach out to your school district and reach out to the resources that are going to be provided tonight. And with that, on behalf of the Commissioner of Education, I thank you for participating tonight, and I'm going to turn it over to Kate Bohannon.
Good evening, and thank you all for joining us for the third webinar in CSDE's series Supporting Your Child's Health and Well-Being During the School Year. My name is Kate Bohannon, and I'm the School Mental Health Consultant for the State Department of Education. And I have had the honor of working with our panelists and partners at CERC to put together this webinar for you all. Please know this webinar is being recorded and will be available later this month on the State Department of Education's website, along with the recordings for our first two events, which were Supporting Child and Family Wellness with Dr. Robert Ketter, a developmental pediatrician from the Connecticut Children's Hospital. And the second event was Preparing Your Family for Cold and Flu Season with Dr. Vermund from the Yale School of Public Health and the Global Virus Network. The recordings will be available in English as well as versions that have closed captioning translation for the top 5 languages spoken in Connecticut. With this in mind, please do not share any personal or confidential information during tonight's discussion, as this is a public space. If you have someone in your life in immediate need of services, please contact the Suicide and Crisis Lifeline at 988 or Mobile Crisis at 211. So I actually have a confession. When we first were planning this series, I was worried that no one would come. Suicide is hard to talk about, and sometimes it's easier to just avoid talking about hard things. But this topic is so important. In 2024, Connecticut has already tragically lost 14 youth ages 18 and under to suicide. 10 of those losses occurred over the summer. Schools are an invaluable source of support and intervention for our children, but the losses this summer highlight just how important it is to have everyone involved in supporting youth mental health. We all need to be having these conversations, even though it's hard. I am so glad that I was wrong about tonight's attendance, and it is encouraging to be in this space with you all. In August, the Department of Children and Families, the Department of Mental Health and Addiction Services, the Connecticut Suicide Advisory Board, the Connecticut Department of Public Health, the Office of the Child Advocate, the Governor's Office, and the State Department of Education all came together and issued a joint public health bulletin entitled Protecting Our Youth, a Community Approach to Suicide Prevention, which was used as an outline for tonight's discussion. The full bulletin in both English and Spanish will be shared in the chat along with additional resources at the end of this presentation. Please share far and wide. I now have the honor of introducing our panelists. Dr. Stephanie Bozak is a behavioral health clinical manager at the Department of Children and Families in Connecticut. In her role, she oversees the Children's Community Mental Health Unit, which is part of the Behavioral Health Community Services Division. She serves as a tri-chair for the Connecticut Suicide Advisory Board and is a co-project director on the Garrett Lee Smith Grant for Suicide Prevention. Dr. Bozak is a licensed clinical psychologist who received both her doctorate in clinical psychology and Masters of Art in Clinical Practices from the University of Hartford. Her broad range of clinical experiences have included providing individual, family, and group therapies to children, adults, and families, as well as completing a variety of different types of assessments within outpatient, school, and residential settings. She has also worked in several supervisory roles, provided administrative oversight of programs, and has created and delivered professional development and psychoeducational workshops to various audiences. Dr. Bozak is passionate about the work involving children, adolescents, and their families. Her clinical interests include youth who have behavioral difficulties, trauma, and resiliency. Prior to joining the Department of Children and Families, her most recent roles include Vice President of Residency Services at Boys and Girls Village and psychologist at the Institute of Living. She is a member of the Connecticut Psychological Association as well as the American Psychological Association. I am also proud to introduce Erica Echevarria. I think I said that right, Erica. I apologize if I messed that up.
That's perfect.
Great. Who has worked as a licensed clinical social worker for 15 years and is currently a behavioral health clinical supervisor at the Connecticut Department of Mental Health and Addiction Services, Office of the Commissioner, Evidence-Based Practices and Grants Division. She has offered direct clinical care and managed various outpatient programs at a private nonprofit organization and inpatient units at Connecticut Valley Hospital. Ms. Erica co-led the development and implementation of the Adult Crisis Telephone Intervention and Options Network, the Central Action Line, the centralized call center for adults in crisis in Connecticut, and serves as the co-project director of the 988 Suicide and Crisis Lifeline in Connecticut. She is also known for her work in the Latino community and currently oversees DEMAS's Latino Outreach Services. She has served as a member of the Connecticut Suicide Advisory Board, statewide coalition, and facilitates the DEMAS Mobile Crisis Regional Learning Collaborative. She earned a bachelor's in social work and criminology at Central Connecticut State University and a master's in social work at the University of Connecticut. I would also be remiss not to mention Andrea Duarte, who is an integral part of our team, who is here with us tonight, waiting in the wings should we need her. Andrea is a behavioral health program manager in the Prevention and Health Promotion Division of the Connecticut Department of Mental Health and Addiction Services. She is also a founding member of the Connecticut chapter of the American Foundation for Suicide Prevention and tri-chair of the Connecticut Suicide Advisory Board. Andrea has worked tirelessly in the field of suicide prevention for longer than she would probably like me to share, but there's a good chance we would not even be here today if it were not for her work. Without further ado, Dr. Bozak, the virtual floor is yours.
Thank you so much. While I am flipping over to my slideshow, I would like to ask everyone if you can just kind of write in the chat where you all are joining from, just because it would be interesting to see where we have folks joining from. And I am going to switch over to the PowerPoint as you do that. All right, so hopefully folks can see the slides. And I also want to echo what Kate said regarding being here tonight. We're going to be talking about a difficult topic, but a very important one. And so I want to invite everyone to also take care of yourselves. And we'll talk a little bit about that later as well. But really appreciate you being here for this conversation, which is so important. So I see folks are writing in the chat, so I appreciate that. As I keep going, please make sure that, again, this is a public space, so please refrain from sharing any personal situations, and understand that if you have any immediate need for support, you can contact 988 or 211, like Kate said, and if there is an imminent emergency, 911 as well. So wanted to just briefly go over what our agenda for tonight is going to be. We're going to first start off by framing the youth in need, our Connecticut youth, and sort of what brought us here to talk about this topic today. Then I'll be going into some factors to consider. What are some of the red flags to look for and risks, as well as how we can help, right? The most important piece is what we can do after knowing all this information. Then we'll be going into some resources, as well as talking about the importance of self-care. You all here are here because you're interested in this topic and how to help, but I also want to emphasize that it's important to take care of ourselves as well. So we'll talk a little bit about that. So the youth in need, as was mentioned before, Connecticut saw some losses over this past summer that was an increase from previous years. And while Connecticut has done a really good job of providing resources for our youth, suicide remains a critical concern for our youth. And when I say youth, I'm talking really more about the 18 and under. In the 2020 SAMHSA, which is the Substance Abuse Mental Health Services Administration, a report came out saying that 2022, suicide was the second leading cause of death. That's a huge leading cause. And when we looked into this a little bit more, in 2023, a report of youth behavioral health. It's a survey that's done for all students. And what that found was that 16% of youth reported seriously considering attempting suicide. 28% of high school students reported having poor mental health in the last 30 days from the time that they were asked. 35 of high school students felt sad or hopeless in the last 2 weeks. And really astonishingly, 51% of high school students felt that they did not have a trusted adult that they could speak to. So these numbers are really, really startling. Of course, we want to ensure that our youth have trusted adults that they could go to. And what really was highlighted is how alone and isolated a lot of our students really felt. So what's causing some of the suicidal ideation and things that are going on? Well, there's a couple of things that are key factors, and things to really remember when we're talking about the factors is that this is a very nuanced thing. There's no one thing that can be pointed at and saying like that's what causes suicide. However, some of the things to consider really include experiences of pain and distress, and that is really really specific to that person and their experience. How one person experiences distress might be different than somebody else. But that feeling of pain and distress, plus the feeling of hopelessness, can really lead towards that risk of suicidal ideation. And that hopelessness is a key factor, right? When you feel like there's really nothing that can be done to relieve that pain and distress, that's when the risk is really high. The lack of connectedness and having means is also really important when we're looking at factors. So that lack of connectedness, that isolation that we talked about before, And having the means or the ability to cause that self-harm can really be a key factor in suicide. And so, what we want to look for and the key things that we want to sort of be mindful of is whether a youth has had a history of any previous attempts. If they have, any history of previous attempts or self-harm behavior has shown to significantly raise the risk of future attempts. The other things that we want to look for are emotional and behavioral indicators. So what I mean by that is, are there changes in their behavior from typical behavior that they used to exhibit? So things might be all of a sudden you're seeing them isolate from family and friends. They start to maybe not take care of themselves the way that they did, and their appearance might change drastically. Things that we might want to look for also are intense mood swings or changes that are significant. We might want to look for whether they're starting to increase in substance use or engage in substance use when they maybe didn't before. Things to look for are also including environmental stressors. So, are there things that have gone on? Are there things in school that are particularly stressful, including social factors, which can also be at school? Are there changing in friends or things like that? There's also a typo on this, I see, but that's supposed to say chronic physical illness. And that's important because it's that sense of hopelessness. If there's a chronic physical illness that a youth is battling, it may lead to that increase of pain and distress and hopelessness about that getting better. And again, like we mentioned before, that means to self-harm. So access to something that could cause harm is important to look at. And I apologize because I cannot see questions or anything like that. So I'm going to lean on my other panelists to just let me know if there are questions as we go. And we'll also have opportunity at the end as well. So now that we know some of the risk factors, what I'd love to see from folks is, what do you think are some important ways to show support? If we see these red flags, if we know that our child is all of a sudden changing drastically in their behavior, if we see that all of a sudden they're expressing a lot of hopelessness or sadness or extreme mood swings, what might be some ways that we can help and support them? I'm going to pause there and see if I can lift up the chat just to see. Yeah, share your observations in a curious way. I really love that. Any other thoughts on what might be helpful? Think about what might be helpful for you if you're starting to feel distress. Being available and present to listen, just listen. I really like what you're saying there, right? And I'll talk about that a little bit because listening is so important. And not listening to fix something, right? But being available and present to listen and hear what's happening. Absolutely. Those are all great. Don't be afraid to ask. Absolutely. We'll talk a little bit about that and asking directly. Check in with them. Absolutely. These are great. So definitely keep them coming. So what can we do? And this goes back to some of the things that we've said, right? We want to promote open communication. And like I said, it's not just communication, talking and having them tell us so that we can fix it, right? And that's really important because sometimes when we're anxious or the topic is scary, sometimes we might just want to like make it over quickly. But it's really important to promote open communication in a way that you're listening, not to fix the situation, but to really try to understand them, be present with them, right? So promoting that open communication and listening without judgment, without saying like, oh, other people have it a lot worse, right? Without judgment, really hearing what they're saying, avoiding dismissing them, and really ensuring that we're actively being patient to allow them to tell us exactly what they're feeling. Provide resources and support. This is really important too, because there might be times where we're not going to be able to help. And so in those moments, right, me taking off my psychologist hat, but as a friend or a parent, right, we need to be able to then encourage the support and resources outside of maybe just what we can do. So staying calm and making sure that we're talking to them and giving them the opportunity to share that, and then being able to respond by providing them, encouraging them to talk to professional help, providing them with the number for 988 or chat and texting 988. Those are all really good ways to provide that support and resource. We also want to make sure that even if there's not an imminent risk, if they haven't said, yes, I have an intent to do something, but they're just thinking about death, right? It's important to acknowledge that they're still sharing distress and pain in that moment. And so making sure that you're listening to that and trying to get to the point of what might be causing that. How can we help that alleviate that pain and distress if we can, right? And really making sure that we're being patient in the moment, because youth, and we'll talk about this in the next slide, but youth may not be able to articulate everything in the way that you or I could. When I say respond is making sure that we're not reacting, right? Staying calm, but also making sure that we're responding, that we're doing something about it afterwards, whether that means encouraging support, working with them to come up with safety plans, talking about what might be helpful. I think I saw in the chat, asking them what might be helpful, encouraging them to utilize healthy coping skills, encouraging them to really engage in supportive things, trying to find a network that's going to be supportive for them, and then ensuring a safe environment. And what we mean by that there is really ensuring that we are creating a safe environment where those access to the means. So if they say that they've been thinking about harming themselves with a certain object, right? Making sure that we then lock those things up. So locking up sharps, ensuring that we have locks with guns if that is in the home, making sure that that safe environment exists so that that access to the means that they could harm themselves is now removed. I'll pause there because I've said a lot so far, and I just want to check in. Whoops. I just want to check in and make sure that I've addressed any questions or anything that have come up in the chat. And I see some, yep, offer a quiet, safe space to talk together, check in with them. These are all really great things. Absolutely. All right. So some things to consider that we want to make sure that we're remembering when we're talking about youth, right? I mentioned this already, but they may not always be able to articulate what they're feeling in the way that makes sense to adults, right? So really being patient with youth is really critical. Ensuring that we're there. Remember, like I said, not rushing to fix things, but just being present with them, to listen to them, to actively listen, maybe reflecting back to them. Is this what you mean, right? Repeating back to them to make sure that you're understanding things the way that they intend to. The other thing to consider and remember with youth is that although they may be in treatment, they may not perceive that as being the type of help that they need. I think earlier in the chat, we talked about somebody had mentioned asking them what's helpful, right? Talk therapy might not be for them. It might be really intimidating. And so ensuring that we talk with them about what is going to be helpful for them. It might be that they need to engage in a social activity or do something creative. And those might be something that they perceive as much more helpful. So really hearing from them. One of the things that I've heard from clients is that oftentimes when they're asked a lot of questions or parents try to help them, it feels almost dismissive because they don't necessarily need things to be fixed right away. They just want to be able to share and feel in the moment with somebody. So asking them what's helpful, right? A trick that I've talked to parents about is asking your youth, do you want help? Do you want ideas for how to fix this? Or do you want to just talk and vent about it? Right? In that way, you can really get from that youth in particular what's going to be helpful in that moment. The other thing to consider is that the brain of youth is still in transition. It's developing, and we all probably know that, right? And so their coping skills, their impulsivity, that's often going to be challenged and limited. So it's really important as the adults and the caretakers to make sure that we are helping them through that coping skill. And coping skills are going to be unique to each person. What's going to be helpful for one person is not going to be the same as for somebody else. And so it's always helpful to talk through, how was that? Let's practice that. It's also helpful to have a whole toolbox of coping skills, because something that you're able to do in one moment, you may not have access to in another moment. So making sure that you have an array of things that they can utilize and helping them through that, right? And ensuring that you are checking in with them about those coping skills. The other thing to really consider is that grief may show up differently in youth than it does in adults. And this is true for everyone, right? Grief is going to show up differently for everyone. And it's not uncommon for youth to express anger as grief, or anxiety, or frustration, or inability to focus. And that goes back to that being able to articulate. If somebody isn't able to express themselves in a way that's similar to how you might understand it, right? We might misinterpret what is being said or what their intent is. So really understanding that grief might look very different. And so if you notice that behavioral change, if you notice that a youth is extremely angry or frustrated or irritable, it might be worth sort of exploring a little bit more what might be going on underneath. And the tips to engage with youth, you want to choose the right moment. Make sure that you're choosing a time where you're both calm, where you have the time to actually talk, right? To be able to have a real deep, meaningful conversation where you're not rushed or there's going to be distractions. It's really important. Using age-appropriate language. The younger a child is, the more concrete you might have to be in the things that you say. Being a good listener. I've said this over and over and over again, but really ensuring that we're listening to listen, not listen to fix, right? Of course, we want to fix things, but the first and foremost thing is to make sure that we're being present and listening to what they have to say. Ask open-ended questions. So genuinely be curious. It's a really difficult topic and a really difficult thing to talk about, but really making sure that you're asking those open-ended questions in a genuine way so that people are able to respond and they feel comfort in that you are really caring about what their answer is. We also want to normalize and validate their emotions. Emotions are normal, they're part of life, good or bad. And so we want to make sure that we're normalizing those emotions and validating their feelings. Again, like I mentioned before, we don't want to be dismissive or say things like, oh, other people have it harder, you're being dramatic, you should have, you should see how I had to deal with things. Those are all very dismissive. And what we want to do instead is really validate their feelings. Saying things like, wow, I can imagine what that's like, right? Or, can you tell me more? I don't quite understand, but validating what their experience is. And again, be patient and consistent. Make sure that you leave that door open for continued conversation. That's going to be really important. And you want to check in again and make sure that things are still, that you're checking in to make sure that you're leaving that door open for them to have that conversation and that permission to talk about it. Sometimes kids often will say things like, well, I didn't want to tell my mom because I didn't want her to worry about me. Or she already takes care of me so much, right? That I didn't want mom to have one more thing, right? Teens often will talk about feeling like they're a burden to their parents when they have some suicidal thoughts. And so making sure that we're allowing that permission to talk to us about what they're going through really helps with that open communication. So we've talked a little bit about some of the resources, and I want to also just mention that in Connecticut, the way that we have set up our resources and our system is following the best practices from the Substance Abuse and Mental Health Services Agency. So with this, what we have done is we have built our system to have someone to contact, someone to respond, and a safe place for help. So our someone to contact, as we've talked about before, is 211 and 988. Our someone to respond is our mobile crisis intervention, and a safe place for help is our urgent crisis centers. and I'll go through these. Our first one, which is our someone to contact, is our United Way call center. And this is our call center that's available to anyone who calls 24/7. And this is through United Way. 988 and 211 will be the number that you can call. And Erica will talk a little bit about the adults, but with the youth, if you are looking for someone to contact, you can call either one, and a call specialist will be available. All of the calls are anonymous for 988, and for 211, if you are looking for a mobile response, what they'll do is they'll connect you to that mobile response. And a mobile response, before I get to that, a mobile response is where they're going to be able to come to you to address any crisis that you're in. One of the neat things that has happened here in Connecticut is that 988 is now required on the back of school IDs. So these are some examples of school IDs that have some information about 988. So students who have school IDs, I would encourage all of you parents to check to see if the back of your IDs have this, and talk to them about this option, right? They can call, they can chat, they can text. This is, again, a way that they can reach out if there is a crisis. And that crisis is self-identified as crisis, right? Again, what's a crisis for me might look different for somebody else. And so that's really important that when someone's in distress, it's their experience of distress. So 988 is something that you can talk to your youth about. And then our mobile crisis services. So as I said, it's who's going to come to you, right? Someone to respond. And this is can be done anywhere. It's a face-to-face clinical intervention for children and adolescents who are experiencing a crisis. Clinicians will go to where you are, whether that's in the home, whether that's in the school, and they'll be able to sort of do an assessment to make sure that they are addressing any crisis in the needs, and then be able to help connect your child to services. Mobile crisis can then also stay open for a period of time to make sure that they're checking in to see if those connections to ongoing services have been made, if there's anything else that comes up. And the way that we do this here in Connecticut is that we have 6 contracted providers. The way to access all of this is again through 211. So you could dial 211 1 and 1, and then you'll talk to a crisis a center where they'll talk with you, find out the details of what's going on, and be able to transfer you to the appropriate mobile crisis team that will then come out to you within 45 minutes of that call. And again, this is available 24/7, 365. The last step, which is somewhere safe to go, are our urgent crisis centers. And this is brand new in Connecticut. It's been open for about a year. And what this is it's a 23-hour program. And what I mean by 23 hours is that you can stay in this program for up to 23 hours. So it's not like a bedded program. It's a program where if you are experiencing distress, your child is experiencing any sort of mental health crisis or distress, there's no appointment that's needed. You can just walk into this center and they'll be able to de-escalate, address what's going on, and ensure that they also do that connection to somebody. Not everybody wants somebody to come to them or be in their house. So this is another option that we have available here in Connecticut where you can go to a center. You don't need an appointment, like I said, and you don't need to go to the one that is located in your area. So say you live in Hartford, but you're down in Waterbury going to some event there and something happens. You don't have to go all the way back to the one that's closest to where you live. You can go to the one in Waterbury at Wellmore. And you can see here, these are the 3 sites. We also have a 4th site, but the 4th site is slightly different, so I didn't include it here. The 4th site is actually at our Yale New Haven Hospital, the children's hospital there. What they are doing is they're going to do all of the same things that an urgent crisis center does, but because they're in the actual emergency department, I didn't include them here. The next thing I do want to address is the connectingtocarect.org website. This is a wonderful tool. If you go to this website, and these are just sort of the 2 pictures of the website itself, you can go there and find lots of different supports, services, resources. There's a neat little map, so you can click on the map to find out what's available in your area. There's also something called the Assisted Intervention Matching tool. What that is you can click that you're a parent or a provider or someone and just kind of go through questions about your child or youth to find out what the best appropriate evidence-based practice or service type would be. And then there's a little description about them. So the website has a ton of information about finding supports, about what to understand about them. It gives brief descriptions of the types of services. So I encourage everyone to take a look at this if you or someone you know is in need of mental health services. There's also information about all of the other things that I've talked about too. So including information about the mobile crisis as well as urgent crisis centers on there. So we've talked about the youth, about some things to look out for. We've talked about some of the resources, but it's really important to talk about self-care as well. Stress can impact us all, which is going to affect our ability to be able to be present and available for those around us. And so, while we're talking about how do we help our youth, the best way that we can do that is be a role model and take care of ourselves as well. And so it is incredibly important that we are making sure to talk to whoever it is that we might need to, whether that's calling 988 ourselves or seeking therapy ourselves, making sure that we are practicing that self-care and taking care of our mental health in order to be sure that we take care of everyone around us. Resources and supports for adults. Favor, which is a family advocacy agency, offers a list of support groups. So if you have a child that you are supporting and you want to be around other people who are also supporting their child and want to have a support group for the things that you are having to manage, this is a great resource. You can go to their website. They also have a Facebook page that lists all of the support groups in the area. And if a support group does not exist in your area, you can go to your local system of care collaborative to request that one get started. So it's a great way to really connect with other adults who might be going through the same things you are in terms of supporting our young people. And now I'm going to pass it over to Erica to talk a little bit about the other resources for adults.
Thank you so much for the introduction, Stephanie. Again, I'm here to talk about the adult crisis services system and services that DMIS offers adults, individuals age 18 plus. We know that both maternal and paternal mental health conditions are shown to impact the well-being of children, right? And in fact, the U.S. Surgeon General released an advisory on the mental health and well-being of parents titled Parents Under Pressure. And I encourage folks to utilize that as a resource as well. But I want to talk about, again, our crisis service system. And as Stephanie mentioned, we look at ensuring individuals in crisis or distress have someone to talk to, that there is someone to respond to them when they are in distress, and that there is somewhere safe to go. So in our state, we have created the Action Line. That began in 2020. And the Action Line is actually an acronym. It stands for the Adult Crisis Telephone Intervention and Options Network. And it is a centralized call center for individuals in crisis to access support and to access our mobile crisis teams. And this was created pre-988, but we continue to have the Action Line, and as Stephanie went over, the Youth Crisis Line, as well as 988, and all of these create an access point and a no wrong door for people in distress. The Action Line is available 24/7, 365 days a year. It may be contacted by calling this 1-800 number that you're seeing here on screen, or by calling 211, pressing 1 for crisis and 2 for adult. They are supporting quite a large number of calls from adults in our state, not just from individuals in distress, but also from third-party callers, family members, providers, law enforcement, friends calling to kind of share their concern about a loved one or someone that they're working with, and they're receiving sort of consultation and telephonic support. In fact, 96% of those calls to the crisis line are resolved telephonically, with about 4% being referred to a mobile crisis team for an in-person response, and less than 1% resulting in an active rescue, meaning someone is really needing a first responder to arrive at the scene. So they will also provide a warm transfer, again, to a mobile crisis team provider, and we'll talk about mobile crisis teams next slide. Perfect, thank you. So our mobile crisis teams provide emotional support, assessment, referrals to ongoing supports or services or treatment beyond the traditional clinical services, but also to community support groups, to the faith-based community, to the recovery community. Again, they provide consultation to individuals who, again, are concerned about someone they know or someone they're working with and are unsure of what to do. And they also provide debriefing to communities and groups impacted by tragic loss, as with the youth mobile crisis teams who are doing some follow-up or continuing to support folks beyond their point of distress or crisis. Our adult mobile crisis teams will also offer what we call or refer to as bridger services, where again, they're continuing to meet with them and offer supports, whether that be clinical or case management, until they are connected with ongoing longer-term services. We have 18 adult mobile crisis teams throughout the state that are DEMIS operated or DEMIS funded, with over 100 staff responding to particular catchment areas, but together offering statewide coverage. There are varying hours of operation by team, but the department is committed to ensuring that they are available 24/7, and we are working on getting there and are close to it. And they have a number of individuals that are staffing the team, including social workers, licensed counselors, case managers, and some even staff, peers, or individuals with lived experience that are part of their team as well. So for Somewhere Safe to Go, we have our first crisis stabilization unit for adults in our state, which we refer to as the Rest Center, which is operated out of Continuum of Care in New Haven. And that really serves as an alternative to unnecessary emergency room visits. They are accepting referrals from first responders, from mobile crisis teams, from law enforcement, and it allows individuals to stay up to 23 hours. And the team there really provides basic needs, assessment, evaluation, and referral. And it's, again, the first of its kind for adults in our state, and we hope certainly not the last, located in New Haven and accepting referrals from throughout the state. We also have a number of crisis respite beds. So there are 100 beds in our state, and the mental health bed registry sort of tracks the number of beds that are available at any given time. But these really provide services and interventions to people who are experiencing distress or some sort of conflict in their current living situation, and offers temporary respite services. And lastly, we have our peer respite program which is called the Gloria House and is operated by New Life 2. And that opened on July 1 and began accepting stays shortly after. It is a voluntary program. It is a short-term respite alternative to traditional psychiatric stays, where there are individuals with lived experience available at the home located in New Britain to offer supports to individuals. In addition to these crisis services, I want to mention that there are other supports and levels of care that are offered through DEMIS operative, DEMIS funded programs and agencies that include outpatient, individual and group therapy, case management, social rehabilitation. So really, when we talk about self-care for parents and caregivers and adults in general, there are services that are available to folks who are not necessarily in distress or in crisis, but who are looking for some sort of support or treatment. And lastly, the crisis services are available to anyone in our state over the age of 18. You do not need to be a DEMIS client to access our crisis line or our mobile crisis services. So that's a very important piece I want to highlight as well.
So we did also want to briefly talk about the Connecticut Suicide Advisory Board. The Connecticut Suicide Advisory Board is a organization, a coalition, I should say, which provides infrastructure and activities for Connecticut suicide prevention efforts. And part of that includes the regional suicide advisory boards, which sort of helps support the overall vision and the statewide Connecticut Suicide Advisory Board. They are more at the local level, and they provide regional and local training opportunities, guidance. They are a wealth of information. And if anyone here is interested in learning more about how to talk to youth about this, or how to talk to friends, or how to talk to just the community about suicide, they offer a lot of different trainings that can really help. These are either called gatekeeper or community helper trainings, and it helps those who may not have a mental health background to be able to comfortably kind of recognize, to sort of be able to talk to and help get people to the right connected help that they need. And so the website that you can get more information is right at the bottom, which is preventsuicidect.org. There's also opportunities if you have an interest in getting involved in that coalition. Folks are more than welcome to join to get information from that. And so that website is where you would go. We also are going to send a link of resources and different things, but that concludes our presentation, and it does offer some time for questions or comments. So I will kind of stop sharing so that we can see if there are any questions or comments that we can address.
Stephanie, there is a question in the chat. Before I call these numbers, should I call my pediatrician? And I think that's probably for the youth line, since it's referring to a pediatrician.
Absolutely. It's a great question. And so it would really depend on what's happening. So the 988 and the 211 are going to be for if you are in crisis. So that is absolutely, if there's some sort of imminent risk or support that you need, 988 and 211 are going to be the numbers to call. If you're looking for sort of suggestions or help, or if you start to see things that you're just not sure about, the pediatrician may be someone that can support that. But absolutely, 988 and 211 can be a great resource to go if you are in that moment where you need some support in that moment.
And the same is true for adults. It certainly is not a requirement that you call a physician before calling any of our crisis lines.
Any other questions or thoughts? I did see a comment that I do also want to go back to, because there was a great comment that somebody wrote. Fran said, don't be afraid to ask if they're thinking of harming themselves. And I do want to address that really quickly, because I think there's a common myth that if you ask somebody if they're thinking about harming themselves, that you're going to give them that idea. And I am here to tell you that that is not the case. And I absolutely agree with Fran in that we should make sure that we're talking about it. Just the same way that we talk about our physical ailments. We talked a little bit about the Suicide Advisory Board, and Andrea and I are tri-chairs, and one of our other tri-chair talks all the time about how we talk a lot about our physical ailments, right? Like, I'm not feeling so great. Oh, I have the sniffles, I have allergies, but we don't do that with our mental health. And so again, going back to what Fran said, don't be afraid to ask if they're thinking something, how they're feeling, what's happening with them. Making sure that we bring that out into the light, because you're not going to give them any ideas that they haven't thought of already if they are already thinking it, right? And so making sure that we're asking so that we can help and support them. And again, it goes back to that, giving them permission to share that that's the distress that they're feeling as well.
Another question in the Q&A. I'm worried about cutting with sharps. What should I do?
Yeah, it's a great question. So first and foremost, really ensuring that you're creating a safe environment. If you know of what they're accessing, we talked a little bit about locking that up, right? You're not going to be able to sanitize the entire environment. We understand that, right? We are not the TSA looking for every little thing, but do your best in ensuring that safety. And then talking to that child about what might be going on, encouraging them to seek professional help, and what might be helpful for them. And depending on the situation, there's other coping strategies that can perhaps be encouraged, that are more positive, right? And ensuring that again, you're creating that safe space for them to come to you, asking them to come talk to you in that moment, and making sure that you're providing them that space to allow them to talk about what's going on, so that they don't turn to that distress becoming physical and having to release it that way.
Yeah, and I think that's great if you become aware of someone who is sort of struggling with those thoughts. I think if you yourself are having those thoughts, certainly calling 988, our crisis, suicide and crisis lifeline. We worked very hard to get those answer rates to 5 seconds or less, so you can immediately access someone who is live, who is trained to provide, supports. They're going to ask you about, your thoughts, if there are any coping skills, encourage you to utilize those coping skills and hopefully get you to a place where you're feeling safe and perhaps no longer experiencing those thoughts. But again, as we talked about, if needed, there are mobile crisis services that are available to respond in person to you. There, are a number of supports that they can help connect you with if you're needing an appointment. But certainly utilizing 988 and giving them a call if you yourself are having any of those thoughts.
Absolutely. I do see a quick question about the services being covered. So 988 and 211 is completely covered. 988 is and 211 are free, as is mobile crisis. So again, if you are feeling distressed, please make sure that you're calling. I also, oh, go
I
ahead.
just know there were a couple questions, there's some in the chat as well about if calling either of these resources will prompt a response from the police. I think that seems to be a concern for some folks.
Yeah, so from the child side, typically what will happen is if you're calling mobile crisis will come respond and they will try to do their best to de-escalate the situation. There may be some times where the youth might need to go to a higher level of care, meaning that they're not able to safely address what's happening. And in that moment, I can't guarantee that every situation is going to be the same. But in that moment, what they're going to try to do is de-escalate as much as possible. If for some reason they're unable to, there might be a chance that police might be called because they might need an ambulance to go to the hospital or something like that. But that's very rare, and it's typically because that youth may really need a higher level of care, or something is really escalating to the point that's endangering safety in that moment. Erica, do you want to answer from the adult perspective?
Yeah, I mean, similarly, law enforcement certainly do not respond to the majority of our mobile crisis calls. They are included if there are concerns regarding safety, right, of the individual in distress and staff. So certainly not for all mobile crisis response. And if law enforcement were to be called to sort of do a co-response, the individual will be notified of that. We'll know ahead of time. Yeah. So it won't be a surprise.
I also saw a question in the chat about when you sort of when the behavior starts to differ from regular teenage hormones and moodiness to something more serious. And what I would say is that we never want to minimize what that child is experiencing. Even if it is typical, I'll say, teenage hormones, we still want to validate what they're going through, because for them, that is probably the most important thing, right? We know that teenagers have all sorts of hormones going on and things like that. And God forbid we minimize or don't address something and it is something more serious. So I think what I would say to that is absolutely take what your child is saying seriously, validate those feelings for them, make sure that you're addressing it and responding to to them so that you're not, either dismissing it or minimizing it, but really making sure that you're there for them and hearing them out. And if it's something that you're not able to help with, encouraging them to then seek out help, whether that is calling 988, getting them connected with therapy or somebody professionally so that they can work through that. And
Another in the Q&A is, why do kids find other kids who do the same thing?
yeah, it's a good question. And I think what happens a lot of times, right? And we talked a little bit about some of the key factors and it being isolation, right? We all want to belong somewhere. Kids, adults, adolescents especially want to belong, right? And so a lot of times, people will find people who have like-mindedness, who are experiencing the same things that they're experiencing. And so it does seem to happen where youth are seeking out other kids who might understand what they're going through, right? Who they feel like they're connected to on something. May not always be the positive thing that they're connecting with, right? And that's what we want to encourage, sort of the positive social connections, encouraging them to really engage in pro-social activities. But it makes sense that people want to feel connected and belonging somewhere. And so that's partly why kids often will seek out and look for kids who maybe are behaving the same way that they are or feeling the same way that they are, because nobody wants to feel isolated or alone in their distress.
I'm
Any
just,
other?
I was gonna say, I was being mindful of time. It is 6 o'clock now. Is there any final questions before we wrap up?
Just one last comment I see in the chat that I want to address. Are the services covered by insurance? So there's no fee or cost associated with accessing our crisis lines or our mobile crisis teams.
Thank you. So in the chat, you will see that there are several PDFs shared there. One is a link to all of the resources that we shared today and some bonus resources as well. And there are also the suicide prevention booklets that were created from the Public Health Bulletin. There's both the youth and adult versions in there as well. And I just wanted, again, remind you all that schools are there as a resource. If you're worried about your child, reach out to your schools. They can help you connect with resources. They can talk through some situations with you. They can meet with your child. They can kind of help figure out that tricky piece, if this is just normal adolescence and hormones, or is there something else going on? I'd also like to encourage you all to keep an eye on your child's social media. A lot of times that can be a window into how they're feeling and what they're thinking and the networks that they're connecting with. And we all know that there's some pretty powerful algorithms out there that can kind of encourage a bit of a rabbit hole. If your child starts to see certain content about mental health, the algorithm will keep showing them that. And then all of a sudden, it's consuming them. So again, just a plug there to keep an eye on your child's social media. Reach out to the school if you need anything. And I thank you all for joining us. Again, this webinar is being recorded and will be available, I believe, by the end of the month on CSCE's website. If you have any trouble finding that, my name is on the flyer. Feel free to send an email to me and I can help you get connected. Take care, everyone. I hope you catch up on some sleep after this eventful week in daylight savings time. And thank you again for joining us.